I'm Stephen Lewis, Chair of the Board of the Foundation, and on my left is Waiseka Debula, who is the former General Secretary of the Treatment Action Campaign, on the board now of the Treatment Action Campaign. General Secretary means Chief Executive Officer, in order to give it the prominence it deserves. And on my right is Ilana Landsberg-Lewis. We are vaguely related. And she is the Executive Director of the Stephen Lewis Foundation. I actually have drafted a brief statement. I suspect that both Waiseka and Ilana will wing it, but I wanted to put something on paper to make sure that the focus was obvious from the outset. The Treatment Action Campaign is the preeminent organization fighting HIV/AIDS in South Africa. It was the first such organization on the African continent. It paved the way for countless others. It became the model in the Herculean struggle against the pandemic. But TAC is now in financial trouble through no fault of its own. International donors are cutting back. The terrible damage done by the cutbacks spares no community-based organizations. The Stephen Lewis Foundation is not a vastly wealthy foundation, but we're not prepared to countenance an unraveling of TAC. It would be a disaster for treatment, prevention, and care in South Africa. We are therefore mounting this $1 million challenge. Simply put, we'll match every penny contributed to TAC up to $1 million between now and March 1st, 2016. There's nothing like TAC. In all my years as UN envoy for HIV/AIDS in Africa, I saw nothing that approximates TAC. That's not to diminish all the other grassroots NGOs that fight the good fight against the pandemic. It's just to say that TAC became a mass movement in confronting an obdurate government that refused to roll out treatment, a government that went so far as to promote treatment remedies that were lunatic concoctions. South Africa has the highest number of infections of any country in the world, well over 6 million. If it were not for TAC, those 6 million people wouldn't be alive today. TAC used a genius combination of litigation on the one hand and community mobilization on the other to take on the government of then President Thabo Mbeki, to force his government to its knees and demand treatment for all. But the job is far from done. There are over 3 million people in treatment, but 3 million still require access. That's TAC's job. No one does it so well. Funders around the world know of TAC's institutional heroism. Now is the time to rally around this extraordinary organization and contribute the funds that are required. TAC needs $2 to $3 million a year for the next 3 to 5 years to fight the virus. Our $1 million challenge is to get the ball rolling. Together, TAC and the Stephen Lewis Foundation will ransack every possible avenue of support. TAC cannot be allowed to fail. It's no exercise in hyperbole to say that millions of lives are at stake. The donors know that. What is wrong? And I feel this very deeply. What is wrong with this world that African lives are so easily discounted? It is an honor for the Stephen Lewis Foundation to support TAC. In 15 years of immersion in confronting the pandemic, I've never worked with people of such principle, such determination, such tenacity, such an inclusive embrace of struggle and pain, such an incredible wealth of knowledge, such nobility of purpose. TAC is an astonishing outfit. We will do everything in our power to keep TAC vibrant and alive. I invite donors everywhere to join in that objective. And I think I should turn it over at this point to Waiseka.
All right. So for me, I just want to talk about the fact that, South Africa just began, as Stephen has outlined, began its ARV rollout very recently. And when I'm saying that it just began its antiretroviral rollout very recently, it is because of some of the advances we've made in pushing for political leadership in South Africa to take full commitment of the HIV response in South Africa. And until 2010, there was barely any ART program in South Africa. We've pushed, and we had a breakthrough in 2003, and without TAC and our allies, I want to emphasize our allies in labor, churches, and our international solidarity comrades, like here in Canada, we would not have been able to put so much pressure on the South African government to at least change its stance on HIV and how it needed to respond to HIV. But we've just begun. The response began drastically to change things on the ground in 2010, where we've now begun to scale up access to antiretrovirals. We're halfway through the battle, but we are beginning to see cracks in our public health system in coping with the current numbers of people on treatment. As you know, South Africa has about 3.5 million people who are on antiretrovirals managed in the public health system that has been neglected for many years, even predating the current democratic government. And some of the challenges we are now faced with is the fact that we are beginning to control the epidemic in South Africa, but at the same time, we have not eliminated new HIV infections. So we have a situation where we are trying to control the numbers of people who should be getting access to treatment to a manageable chronic illness, but at the same time, the numbers of new infections continues to increase, which means we have a dilemma and a situation where we all say we are ending HIV and we are close to elimination. That is all a myth. And I'm saying this because UNAIDS, amongst many agencies, have been pushing this agenda that we are winning the war, we are winning the war. The war is probably being won in the first front. The first front is we are beginning to control the epidemic, especially in Africa. We are not even very close to ending the war in HIV because the incidences have not been managed. And when I'm talking about HIV incidences, and I'm talking about who is probably going to die in the next 50 years, is young women. And in South Africa, that's the current reality. And if we have forced the state to change its stance for 10 years, it refused to change the HIV policy, what's going to stop it? When there is no one who's putting pressure on the state to continue to focus on controlling and eliminating the HIV epidemic in South Africa, if there is no civil society, if there is no treatment action campaign, governments go to sleep. They go to sleep, and money directed to HIV is redirected to private pockets. We see an escalation of corruption, even in the public health system in South Africa. It's not something unique to South Africa. It happens across the board in developing countries. And it's only civil society holding the state to account for public resources, but at the same time to put the money where social policies need those responses. And I'm not saying this because I'm from Treatment Action Campaign, and we do need to be saved and make sure that we have running resources to be able to scale up our work. But I'm saying it because there are many comrades from women's rights organizations, child health care, maternal health care, who are continuously faced with a situation whether we should close our doors and not allow to take on more support anymore. And at the same time, inequalities have continued to increase. People who are wealthy are becoming smaller and more stingy. They're not prepared to share their resources with the rest of the world or even the rest of populations in their own countries. And without support from people who have something and share it with other people, at the expense that we will run at a risk where even the gains that we've made in the last 10 years, we can quickly go back to square one. In South Africa, that can happen with the blink of an eye because we have not been able even to manage to control the epidemic at a very, very high sophisticated level. We have stockouts on regular basis since 2010. Whereas we increase the numbers of people on treatment, we continue to see supply chain problems. We continue to say, I'm even just talking about first-line regimen. I have not even spoken about second-line drugs, third-line drugs, which are probably a luxury in countries as rich as Canada, as rich as the United States, as rich as the United Kingdom. In South Africa, only recently in 2013 that third-line drugs have been available to public patients. People have been resistant to ARVs for many years, had no options because the cost of drugs is still very high. Today, if you were to buy, third-line regimen in South Africa, you have to have at least up to 30,000 rands as an individual. The state will obviously limit the numbers of people who have to access those drugs because they're highly inaccessible. The struggle around access to treatment, we didn't fight to just live for 10 years. We fought for our children, for our future generations to live in an AIDS-free generation, in an AIDS-free environment. And until we go back to the drawing board and say, we are only halfway through the marathon. We are not yet even close to the finishing line. And for us to now turn back to foot soldiers who change the rhetoric, who changed the paradigm and the discourse around HIV policy and redirected the focus of the whole world about who matters the most, who raised the voices when many people were agreeing to each other that AIDS is not a problem. It is the same people who are today begging, and I hate to use the word beg, and today who are begging for you not to turn away, not to turn a blind eye to what is happening. There's continuous redirection of resources. They are going back to where they were, and now we're seeing society struggling on their own. Be counted and be part of a solution, at least see through the AIDS epidemic ending, see it through to the elimination, and see it through that there will be a generation, my daughter who's 8 years, who will not live in a society where HIV is automatically going to be part of their future. If you believe in that, you believe in us, believe in what we are doing on the ground is genuine and it's legitimate, we are accountable civil society. If you believe in us, then you need to put your penny and your dollar and your rand, your shilling on the table.
Thanks, Weseka. Don't know how much better it could be put. I turn things to Ilana.
Well, for the foundation, it's very straightforward. We came into existence precisely to get funds directly into the hands of community-based organizations, frontline workers and activists like TAC. And all of us at the foundation feel that it's tremendously important to stand with TAC now in this way. We've been proud to support TAC and work with TAC since 2006. And so we know firsthand how extraordinarily effective and crucial the work is. And as Stephen said, it's just unacceptable that TAC should be in this position and in danger of failing. It simply can't happen. It would be a travesty. And I think for us at the foundation, we also feel that it would be an ominous harbinger of things to come for all the community-based organizations and networks that are working so tenaciously at community level across sub-Saharan Africa.